Hello everyone and a warm welcome to the Nursing Milieu channel. We're here to unravel the wonders of the human body, focusing today on the cardiac system. We'll explore the journey of blood through the heart, the vital role of red and white blood cells, and the top cardiac diseases. We'll also delve into the most common cardiac medications and preventative measures. And of course, we'll give you tips on understanding and mastering this complex system. Are you ready to dive into the fascinating world of the heart and blood? Join us on this insightful journey. At the center of our body's function is the cardiac system. It's a complex network, with the heart serving as the central hub. This system is in charge of moving vital oxygen and nutrients to each cell of our bodies. The heart, a muscular organ of the size of a fist, is divided into 4 chambers, 2 atria at the top and 2 ventricles at the bottom. The heart's purpose? To pump oxygen-rich blood throughout our bodies. Here's how it does it. Blood lacking oxygen comes from the body into the right atrium. Then it's moved into the right ventricle, which sends it to the lungs. Here, carbon dioxide is swapped for fresh oxygen. The oxygen-rich blood then returns to the heart, entering the left atrium. From there, it's pushed into the left ventricle, which drives it to the body via the aorta, our main artery. The heart's pumping ability is regulated by an electrical system, ensuring effective beats. It's a well-tuned mechanism, with each part playing its role like a harmonious symphony. Wondering what's in this blood that the heart is pumping? It's red blood cells, white blood cells, and platelets, each with their own purpose. Red blood cells carry oxygen, white cells fight infections, and platelets aid in clotting. Together, they ensure our body's function. Inside red blood cells is a protein, hemoglobin. It transports oxygen from the lungs to the body's tissues. Normal hemoglobin ranges are 13 to 18 grams per deciliter for men and 12 to 16 for women, but these values can vary. The cardiac system's function is critical, ensuring that each cell in our body gets the oxygen and nutrients it needs. Without circulatory efficiency, our cells would starve, causing organ failure and death. Thus, the cardiac system is our body's delivery service. It ensures that essential substances are delivered where needed. A tireless worker, the heart beats roughly 100,000 times a day, delivering around 2,000 gallons of blood daily. So that's how our heart tirelessly pumps blood throughout our body, every second of every day. Now let's turn our attention to our blood cells. These microscopic warriors are the backbone of our body's complex highway system. Let's start with red blood cells, or erythrocytes. These disc-shaped cells are like delivery trucks, constantly transporting oxygen from our lungs to every corner of our body. The average healthy adult has about 4 to 5 million red blood cells per microliter of blood. Next up, we have white blood cells, or leukocytes. These are our body's defense force, always on guard to fight off intruders like bacteria, viruses, and other harmful substances. They're fewer in number compared to red blood cells, usually ranging between 4,000 and 11,000 per microliter of blood. Then, we have platelets, or thrombocytes. These are the medics on the battlefield, rushing in to clot blood and prevent excessive bleeding when we get a cut or a bruise. A healthy adult typically has 150,000 to 450,000 platelets per microliter of blood. Now, let's talk about hemoglobin, the protein in red blood cells that allows them to carry oxygen. It's like the fuel in our red blood cell delivery trucks. The normal range for men is about 13 to 17 grams per deciliter, and for women it's about 12 to 15 grams per deciliter. It's essential to understand that these cells aren't working in isolation. They're a team, each with a specific role, working together to ensure our body functions smoothly. When their numbers fall out of the normal range, it can indicate various health issues, from infections and anemia to blood clotting disorders and even cancer. So the next time you get a blood test, remember these numbers. They're not just random figures on a lab report. They're a snapshot of how well your body's microscopic warriors are doing their jobs. These tiny cells, each performing their distinct roles, are what keep us alive and well. But why is this circulation so important to our body, you may ask? Allow me to clarify. Picture the human body as a vast, bustling city. The blood vessels are the roads, highways, and byways of this city. They transport vital resources to every corner, ensuring all areas function harmoniously. Blood, in this analogy, is the life-sustaining delivery service, ferrying oxygen, nutrients, and hormones to the cells and organs that need them. Now, imagine what would happen if the delivery service stopped. The bustling city would grind to a halt. Similarly, if blood circulation is impaired, our body's cells and organs don't receive the nutrients and oxygen they need to function. The consequences of this can range from mild discomfort to life-threatening conditions. For instance, when blood flow to the heart is blocked, it can lead to a heart attack. A stroke, on the other hand, can occur when blood supply to the brain is interrupted. Poor circulation can also lead to peripheral artery disease, causing pain and fatigue, particularly in your legs and feet. On a cellular level, improper circulation means that the red blood cells, which carry oxygen, and the white blood cells, which fight infection, can't do their jobs effectively. Platelets responsible for clotting may also be affected, leading to excessive bleeding or clot formation. Even something as simple as cold hands or feet can be a sign of poor circulation, indicating that the body isn't effectively distributing heat. In many cases, these symptoms can be an early warning sign of more serious conditions, making it crucial to understand and monitor our body's circulation. Moreover, proper circulation aids in the removal of waste products and toxins from the body. This detoxification process is a vital part of maintaining overall health and preventing disease. So the question isn't really why proper circulation is important, but rather, how could it not be? It's the highway system of our bodies, the delivery service for our cells, and the waste removal service for our organs. Indeed, the importance of proper circulation cannot be overstated. Unfortunately, our heart can sometimes run into problems. It's a resilient organ, but it can be affected by diseases. Today, we'll explore 5 cardiac diseases, their impact on the heart and body. First up is coronary artery disease, or CAD. This prevalent heart disease occurs when the arteries supplying blood to the heart harden and narrow due to cholesterol and plaque buildup. This can hinder blood flow, causing chest pain, breathlessness, and potentially a heart attack. Next, we have heart failure, also known as congestive heart failure. This doesn't imply a non-functional heart, but a heart that's not pumping efficiently. Symptoms include fatigue, breathlessness, and swelling in the legs and ankles. Third are arrhythmias, or irregular heartbeats, happening when the heart's electrical impulses malfunction, causing abnormal heartbeats. While some arrhythmias are harmless, others can trigger bothersome or potentially fatal symptoms. Fourth, we have valvular heart diseases involving malfunctioning heart valves. This can lead to breathlessness, chest discomfort, and fatigue. Lastly, there's cardiomyopathy, a heart muscle disease making it tough for the heart to pump blood. This can lead to heart failure. It presents in different forms, including dilated, hypertrophic, and restrictive cardiomyopathies. These diseases present unique challenges, disrupting normal heart functioning and impeding blood flow, hence depriving our bodies of vital oxygen and nutrients. The effects can be felt throughout the body, causing symptoms ranging from fatigue and dizziness to chest pain and breathlessness. However, these diseases aren't a death sentence. With proper care and management, heart disease patients can lead active lives. This highlights the importance of understanding these conditions. In our next segment, we'll discuss some common medications used to treat these diseases. So stay tuned as we continue our journey through the fascinating world of the cardiac system. Thankfully, there are medications that can help. Yes, that's right, we're going to dive into the world of pharmacology, specifically focusing on cardiac medications. These are the top 5 most commonly used types of cardiac drugs that help correct or prevent cardiac diseases. First up, we have the calcium channel blockers. These handy little molecules work by preventing calcium from entering cells of the heart and blood vessel walls. This results in less forceful heart contractions and a widening of the blood vessels, which lowers blood pressure. Some common names you might recognize are amlodipine, diltiazem, or verapamil. Next on our list, we have the beta blockers. These medications slow your heart rate and reduce the force of your heart's contractions, lowering blood pressure. They also help to open up your blood vessels, making it easier for blood to flow. Look out for names like metoprolol, atenolol, or propranolol in this category. The third group is known as ACE inhibitors, short for angiotensin-converting enzyme inhibitors. These medications help relax and widen your blood vessels by blocking the formation of a natural body chemical that narrows blood vessels. This results in lower blood pressure and less strain on your heart. Examples include lisinopril, ramipril, and enalapril. Moving along, we have antiarrhythmics. As the name suggests, these medications are used to treat abnormal rhythms of the heart, known as arrhythmias. They do this by controlling the electrical signals in the heart. Names you might recognize here include amiodarone and flecainide. Last but not least, we have statin drugs. These are used primarily to lower cholesterol levels in the blood, which can help prevent heart disease. They work by blocking a substance your body needs to make cholesterol, thereby reducing the total cholesterol in your blood. Common statins include atorvastatin, rosuvastatin, and simvastatin. Now it's important to note that while these medications can be highly effective, they're not a magic bullet. They're typically used in conjunction with lifestyle changes like diet and exercise. And remember, each of these medications can have side effects, so it's crucial to use them under the supervision of a healthcare professional. And there you have it. A whirlwind tour of the most common cardiac medications. From calcium channel blockers to statins, these drugs play a vital role in managing heart conditions. They help to control symptoms, prevent complications, and improve the overall quality of life for those living with heart disease. These medications, while not a cure, can significantly improve the quality of life for those with heart conditions. So, let's celebrate the marvel of modern medicine and continue to learn more about how we can keep our hearts healthy and strong. Until next time, keep learning, keep growing, and keep taking care of your heart. So, how do we keep our heart healthy and strong? First, it's crucial to understand the cardiac system inside out. It's not just about memorization, but about making connections and understanding the why behind the how. Use diagrams, flashcards, and mnemonic devices to remember complex terms and processes. For example, creating a mental image of blood flowing through the heart, carrying oxygen, can make it easier to recall the process during exams or in practice. Next, staying current on research and advances in cardiac health is key. Subscribe to medical journals, attend seminars, and engage in discussions with your peers. This will not only help you stay up to date but also deepen your understanding of the subject. Now let's talk about prevention, which is always better than cure. Regular exercise plays a significant role in maintaining a healthy heart. It strengthens the heart muscle, lowers blood pressure, and helps maintain a healthy weight. So lace up those sneakers and get moving. A heart-healthy diet is just as important. It includes plenty of fruits, vegetables, lean meats, and whole grains. Limiting sodium, saturated fats, and added sugars also aids in preventing heart disease. Regular checkups are a must. They allow for early detection of potential issues and help manage existing conditions. Remember, cholesterol and blood pressure levels can sneak up without any symptoms. Lastly, kick bad habits to the curb. Smoking and excessive alcohol can wreak havoc on your heart. If you smoke, seek help to quit, and remember, moderation is key when it comes to alcohol. Understanding, studying, and mastering the cardiac system takes time and effort, but it's a rewarding journey. Remember, the knowledge you gain isn't just for passing exams, but for ensuring your patients receive the best care possible. With the right approach, you can not only master the cardiac system but also become a proactive advocate for heart health, both for yourself and your patients. Remember, a healthy heart is a happy heart. Let's now discuss a common issue: hypertension. Hypertension, or high blood pressure, is when the force of blood against your artery walls is too high. Like water in a garden hose, if pressure is too high, it can damage the hose. Hypertension can cause heart disease, stroke, kidney disease, among others. It's often called the silent killer because symptoms are usually not obvious. Treatment includes medication, like diuretics and beta blockers, and lifestyle changes. A diet low in salt and high in fruits and vegetables, regular exercise, stress reduction, and limiting alcohol and tobacco use can help. Regular checkups are crucial to monitor your blood pressure. Hypertension, while common, can be managed effectively with the right approach. We've covered a lot of ground today, haven't we? We've journeyed through the complexities of the cardiac system, dissecting it from the pathological perspective to understanding the vital role of blood cells. We've delved into the importance of proper circulation and how it impacts our overall well-being. We've tackled the top cardiac diseases, giving you a glimpse into their effects on the heart and body. We've also highlighted common cardiac medications, providing insights into their mechanism of action. We've offered tips to master your understanding of the cardiac system and shared dietary advice for a healthier heart. And we've not left out hypertension, discussing its management in detail. Now it's your turn to act. If you found this content insightful, please give it a thumbs up, share it with those who might find it helpful, and don't forget to subscribe to the Nursing Milieu channel for more enlightening videos. Thank you for joining us today. Remember, knowledge is power, especially when it comes to our health. Stay curious and take care.